I will then answer your questions again. So this is an amazing opportunity to have any health questions you have answered. And you don't get this very often. Most doctors, I get the complaint all the time. People are saying, well, I don't have time. I'm with my doctor 6 minutes, 7 minutes. I think the average now is 7 to 9 minutes with a doctor. So this is a great opportunity if you have the questions answered. And you don't have to worry about insurances or making appointments. Just send it in. Folks, welcome. All our cameras are up and running. If you're new to the show, I'm going to talk for 24 minutes. At the end of 24 minutes, you can ask any question you want in that 24 minutes. John, my producer, will read the question. Just type it out on the platform you're on. And then I will do another 24-minute segment. I'll answer questions again. And if you're listening to this on a replay, you could always send us questions through the website, drjoe.com, drjoe.com. So I am ready to start whenever you are, John. Ready? Hey, folks, Dr. Joe Esposito here. Glad you're with me today, as always. I've been in practice a long time, and people come to me all the time, and they become taint-nothing patients. Now, what's a taint-nothing patient? They say, well, Doc, I have shooting pain down my arm. Taint nothing. Don't worry about it. Well, Doc, I have severe pain, worst headache I've ever had in my life. Don't worry about it. You're coughing up blood. Doc, it's probably just a dry air. So they say it taint nothing. Ain't nothing. See what I'm doing? Taint nothing. It ain't nothing to worry about. That's not true. We're going to talk today about some symptoms that you may have, and a lot of people do have. And this show is inspired, as all my shows are inspired. I was at a party last weekend, and as soon as I walked in the door, I think I was 4 steps into the door, and somebody said, "You're Dr. Joe?" "Yeah." "Hey, can I ask you a question?" And I started asking me questions. "Oh, I know you must hate this." I said, "No, I really do. I love when people ask questions." But as people probably in their 50s and 60s, for about 3 hours, it was nonstop questions. One person walk away, another person would come up. So we all have health concerns, and we don't know what to do about them. And that's a big issue because we don't know where to turn. Healthcare costs, what are they doing? They're skyrocketing. And we don't know what the future is going to hold with insurances, and it's going to be discount insurance plans. The insurance companies are making plenty of money. Don't worry about them. You don't have to feel bad about them. They're raking in record profits. But doctors are getting paid less and less. I did an analysis with one insurance company. I won't say who. They pay us $3 less than I used to get paid 40 years ago for the same services. So doctors are saying, I don't have time to deal with patients anymore. I have to see more patients or charge more. Can't charge more because I'm in these networks that the insurance companies force us to be in if we're going to get patients. And so you have to take care of your own health. Now, there are some things you don't have to worry about, some things that you should. So your body's going to give us warning signs if something's wrong. Symptoms, not that big a deal. Don't ignore the ones, though. So let's talk about some serious health concerns and then what you should do about them. So I'm going to start with the heart because, of course, heart will kill you if it doesn't work. So you have chest pain or pressure. That could be a heart attack. Now, for men, pain in the chest, shooting down the left arm. Women oftentimes jaw pain, and they feel anxious. If that occurs, go get it checked. Well, I don't want to. I don't want to go to the hospital. I don't want to wait in the emergency room. Heart attacks get priority. If you're having chest pain, you go to the emergency room, you get put right in front of everybody else. So go get it checked. I hope it's nothing. One of my coworkers the other day was having some chest pain. Went to the urgent care, checked him out, said everything was fine. Good. That's what we want to hear. We want to hear there's nothing wrong. But don't ignore those things because it can be too late. Shortness of breath, especially at rest. Now, if I run upstairs or something like that, I grab my breath, it's no big deal. But if you have shortness of breath just by sitting there, it could be a serious issue. I'll tell you a story about my father. I came home. My father had a heart condition. He had a rheumatic fever as a child, which caused it didn't get it treated as a child, and it caused an inflammatory reaction in the heart and weakened his mitral valve, one of the valves in the heart. So I'm in college, first year of college. I'm living at home. And I come home, my father's sitting at the kitchen table gasping for air. And he's turning yellow. I freak out. I carry him upstairs. I was a big football player at the time. I carry him upstairs. I get him dressed. We call the ambulance. The ambulance comes, takes him to the hospital. His lungs were full of mucus. Now, he was not supposed to smoke, but he kept smoking, ignoring the doctor's advice. And the doctor said 2 or 3 more hours he would have been dead. So they pumped all his fluid out of his lungs, and he lived many, many years after that. He did stop smoking, by the way, after that. So if you have shortness of breath and you're just sitting around, that could be a pretty serious sign. We talked about jaw pain. Oftentimes that's an indication for women, but jaw pain, left side especially, pain down the arm, could be heart related. That isn't always. Like I said, one of my coworkers went to the ER, went to urgent care, nothing wrong. Good. So don't take that chance because it could be too late. My father was being a stubborn old Italian guy, and when he couldn't breathe, we forced him to get the ambulance. He said, I don't want the lights. So we had the ambulance come without the lights, and that was how we got him there. A lot of people come to me and they say, Dr. Joe, I have tachycardia. Anybody know that word? Tachycardia means rapid heart rate. So many times if you have tachycardia, they can give you medications for it, or they can do an ablation. They can shock your heart to try to get it to beat regularly again. Not just tachycardia, but irregular heartbeats. And it could be a heart rhythm problem. It could be a shock. But here's what I find a lot. When people have irregular heartbeats, or very rapid heart rate especially, it could be the stomach. Now, let me explain this to you. Your body is a big set of nerves. I don't know if you've ever been to the Bodies exhibit. I don't know if you've ever been to that. It's really cool. But we can take out everything except nerves in your body. And just have you standing there with nothing but nerves, you still have a profile of what you look like. We can still kind of guess who you are. You have that many nerves in the body. So if the nerves start to malfunction, that can be a pretty serious issue. So there's three nervous systems in the body. There's the central nervous system, which is your brain and spinal cord. Your peripheral nervous system, which is everything outside the brain and spinal cord, except for the digestive system. That's called the enteric nervous system. The enteric nervous system is connected to the central and peripheral nervous system, and it controls your digestive system. Now, it's theorized that your digestive system is so complex that it had to have its own nervous system evolve. Now, think about what your digestive system does. It's crazy. It takes double beef cheeseburger with an artificially processed cheese food spread on white bread that never goes stale, and it breaks it down and utilizes the few vitamins, minerals, nutrients, and amino acids in there for the body to function. That's phenomenal. And it's so intricate that it has its own nervous system. Now, if the enteric nervous system is irritated, gas, bloating, diarrhea, constipation, acid reflux, Crohn's, colitis, irritable bowel syndrome, anybody? Does that sound familiar to anybody? That can affect the enteric nervous system, which can affect what's called the vagus nerves, and the vagus nerves also control your heart. So we're irritating the nerve on one end, causing it to malfunction on the other end, which can cause the heart to beat rapidly. And when I was a child, reminds me of a Pink Floyd song. You get it if you're old enough. When I was a child, I remember laying in bed and my heart just racing uncontrollably. And then it would stop. And then it would start again. And I thought, well, I'm not dead, so I guess this is what hearts do. I was a little kid, probably 6, 7, 8 years old. And years later, I had this problem for years. And years later, I realized my stomach was pushed up against my diaphragm. I had terrible breath when I was young. I was always bloated when I was young. Once I got my stomach fixed, all that went away. So it's one of the things I did for my health that was just phenomenal. It took me a while to figure all that out. And you can actually move the stomach. You can pull the stomach away from the diaphragm. And when I did, well, one of my doctors did at the time, probably 30 years ago, my heart never was rapid again except one other time. And I went out to Ethiopian restaurant, my friend Tim, and we ordered one meal for two. If you ever go to Ethiopia, you only get one meal for two people. There's plenty of food. But Tim was hungry, and Tim wanted a side dish to go with it. So we got an extra side dish. And I ate too much. And I remember driving home, and my heart was just racing. And I thought, well, I don't do caffeine. I didn't do any stimulants. My stomach was so full, it was irritating the vagus nerve, which was irritating my heart. And I remember sitting in a chair in my house and saying, this is going to take about 3 hours to digest. So I walked around, I went for a walk, I went outside, and eventually, once the food started to digest, my heart rate dropped. So it was my digestive system causing my heart to give the rapid heart rate. And so that could be an issue with you. So if you have heartburn, burping, gas, if you're on some type of medication to cut down on acid reflux, and you have rapid heart rate, consider they might be related. So before we go in there, shock the heart, come see us or somebody who knows what they're doing. There's not a lot of doctors that know these techniques, unfortunately. And we can actually work on the stomach to see if we can normalize the enteric nervous system, which can then normalize the heart rate. Isn't that crazy? And it also raises your blood pressure. If the stomach is up against the diaphragm, it can raise your blood pressure. And I've had countless people over the years come to me on medication, and they say, I want to come off my medication. I said, I can't take you off your medication, but let's do everything we can to normalize the blood pressure so you can go back to your prescribing physician and say, hey, I'm done with my blood pressure is doing better. Can I come off the medication? And in many cases, most cases, the answer is yes. But I can't take you off the medication. You have to let your prescribing doctor do that. So blood pressure sometimes is a physical problem, not a chemical problem. Same thing with rapid heart rate. This is such a hard concept for most people to understand because we are so indoctrinated in the fact that I have a problem, take a pill. I'm not against pills. I have a traumatic brain injury. And if my traumatic brain injury starts to act up, I get a headache. Now, sometimes I can do white willow bark, which is a kind of a natural aspirin. It's where aspirin came from originally. And many times that calms it down. But sometimes I need to take acetaminophen. Now, acetaminophen has side effects, doesn't it? Affects the liver. It can affect blood vessels. So I always take an extra dose of Dr. Joe's Super Greens, which has chlorella in it to help clean out my liver, and an extra dose of Dr. Joe's glutathione to help clean out the liver. So I'm not against medication. I'm not against surgery. But what can we do to mitigate the damage that occurs? And something as simple as Super Greens for liver issues and glutathione really helps tremendously. Now, with high blood pressure, we can take medication, but there's also a gas that's produced in your blood vessels called nitric oxide. And nitric oxide opens up your blood vessels. And when the blood vessels open up, the blood pressure drops. So I take nitric oxide support every day. Now, my blood pressure is perfect. But I don't know if I'd have high blood pressure. I take nitric oxide every day, but I don't think I would. I eat a very good diet. I keep my nervous system healthy. But nitric oxide can open up the blood vessels to lower your blood pressure. So once again, fix the stomach, go talk to your doctor. Let's look at the nitric oxide. Maybe try that for a couple of weeks and let's see what happens. And it increases circulation to your brain, sex organs, liver, spleen, kidneys, everything. So it's really cool when we can naturally get the body to start doing what it was supposed to do. And it's just, think of your body like a car. Tune it up, put good gas in it, it's going to run better. But for some reason in healthcare, especially in this country, we think something's not working. What chemical can I use to fix it? Sometimes you need it, sometimes you don't. So if you're just tuning in, I'm Dr. Joe Esposito. We're talking today about warning signs you should never ignore. Because patients come to me all the time and say, well, doc, I've had this chest pain, shooting pain down my arm, and it's been going on for a couple of days. Get to the emergency room. I hope I'm wrong. I want to be wrong. But sometimes I'm not. I had several patients over the years. We take an x-ray, and we x-ray their lower back, and from the side view, we can see what's called their aorta, which is your big blood vessel, and it splits into something called the common iliac arteries. And many times we can see calcium built up in the aorta or in the common iliacs. And I'll tell people, if I can see it on an x-ray, it's bad. Now, it's only supposed to be 5.5 centimeters or 55 millimeters. It's supposed to be lower than that. If you get to 5.5 millimeters, or 5.5 centimeters, I tell people you need to get to the emergency room immediately. Well, I have an appointment with my cardiologist now. Because at 55 millimeters or 5.5 centimeters, that could mean that it's going to burst. And if it bursts, you die instantly. You don't get a second chance on this one. So when I see plaquing of the arteries and I start to see the aorta starting to get expanded, it can be what's called a dissecting aortic aneurysm. We got to get you to an emergency room immediately. And over the years, I'd probably say 5 or 6 times, I've gotten calls from their cardiologist, from their internist, and say, I've been treating this patient for 20 years. How did you spot this? It's on the x-ray. It's real simple. Thank you. You saved my patient's life. I remember one time I had a guy, it was a Friday, and he didn't want to go till next Monday. I said, no, you're going to the emergency room now. And his wife was like, oh, he's fine. He doesn't have any symptoms. And they did emergency surgery on him. And the wife came back in and said he would have died. They said maybe within a couple of days. He might not have made it through the weekend. So, I mean, serendipitously, I found exactly what I needed to find at exactly the right time. So if you have a health issue, do you have any health issues? Neck pain, back pain, shoulder pain, digestive issues, nutritional concerns? Make an appointment to come see us. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge, or we can do, telehealth if we need to. I want to be your doctor. Normally, the first visit with us is $990, actually. We reduced that to $299. That's an exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. Any one of those services is going to be more than $299. I do this because I want to find out what's going to be the best course of treatment for you. Is it treatment with us? Is it nutrition? Is it maybe you need a cardiologist? I don't know. Let's find that out. And we accept most insurances. So if you want to make an appointment, and I think you should, drjoe.com, drjoe.com. You can book it right online. We can usually get you in within a day or two. We want to do everything we can to help get you in the right direction to get well and stay well. And sometimes it's an emergency. Most times it's not. But my team of doctors and I are really good at back pain, neck pain, back pain, shoulder pain. We do chiropractic work. We do nutritional work. We can refer you out to other doctors if we need to. Let's get to the cause of your healthcare problem. And I always say, stop suffering needlessly. So many of you are suffering, and you don't need to. And patients tell me all the time, why didn't I do this sooner? Why didn't I come see you sooner? I don't know. I've told the story before. I had a patient come in the other day 10 years ago. Well, came in 10 years ago. Started feeling better, stopped coming in. We called him up. We said, hey, we'll call him Bob. Bob, your spine is not stable. You're just out of pain. We put a Band-Aid on it, okay? I'm fine. I'm not coming back because we take notes on everything. 10 years later, he comes walking to my office, I think it was 2 weeks ago, and says, I just got back from the doctor. My discs have deteriorated and dried out. I have severe arthritis, shooting pain down my leg, and I don't know what to do. They're talking about fusing my back together. And the guy looked at me almost in tears and said, you were right. I shouldn't have stopped coming in. And that's the thing. You never reach maximum dental improvement. You're always going to brush your teeth. You're always going to go to the dentist to maintain it. And that's what we need to do at our spines. If I can get that point across to you today or anyone listening, or at healthcare in general, maintain the nervous system, maintain the digestive system, maintain a good diet, we will reduce healthcare by billions and billions and billions of dollars, probably trillions. Because we wait till it breaks before we fix it. I don't want to do that. So if you want to make an appointment, drjoe.com. And you can send me any questions you have through the website, drjoe.com. Any health question, happy to answer your questions for you. And I do that as a service to you, drjoe.com. So we're talking today about warning signs you shouldn't ignore. If your legs start to swell and your ankles start to swell, there's two types of swelling. There's pitting and non-pitting edema. Now, non-pitting edema is I push on it and it bounces right back. That's not so urgent. It could be a kidney issue, could be a circulatory issue, could be pinched nerves in the low back, could be a bad diet. If I push on it and it stays, like remember Play-Doh, you'd push on Play-Doh and it would leave your thumb imprint there? That's called pitting edema. That's something we have to be concerned about. And so when I see people with pitting edema, it's not necessarily call the ambulance right now, but I want to get you to a cardiologist as soon as possible because it could be heart failure. And heart failure sounds horrible, but heart failure can go on for decades. It just means your heart isn't working as well as it should. So heart failure sounds scary, but it could be something, okay, what do we do about it now? Let's get you on a good diet. We talk about a salt-free diet. Maybe not the best thing for you. Some people are very sensitive to salt, some aren't. So we can't just lump everybody together and say this is going to work. And it may not be the sodium, the salt. It may be an imbalance between potassium and sodium or magnesium and potassium and sodium. And so that's why I recommend air-dried sea salt, something called Celtic salt, because it has 70 other minerals in it aside from sodium to help balance out the issues. When you just use sodium, there's a problem. It throws off the ratio, we call it. So you got to get those ratios right. And the easiest way to balance out your ratios are eat a plant-based diet, fruits, vegetables, nuts, and seeds. And if you don't know what to eat, send me an email through my website, drjoe.com, and I will send you a talk that I did. I was in a studio one day, and I talked for about 45 minutes called So What Can I Eat? And it breaks down very clearly breakfast, lunches, dinner, snacks, cleaning out your pantry. And I'd love for you to do it all, but I also understand not everybody's going to do everything. So just make some small steps. Start with supplements. Take Super Greens Essential Source, B Complex, and Vitamin D. Those are on our website, drjoe.com. And those are special forms of vitamin B. It's called methylated. The vitamin D3 has vitamin K2 with it, which helps clean up your arteries. So Super Greens Essential Source, D3 and K2, that's the starter kit. Now, I take nitric oxide every day for circulation. If you have high blood pressure, probably a good idea. Don't take it if you have low blood pressure. It may make you crash. We have a chewable with citrulline and ginseng. Makes you feel good, gives you energy, helps calm down the nervous system, helps the immunity. And that's a chewable. It tastes really good, too. I take omega-3 fatty acids for brain function and for anti-inflammatory reactions. Because omega-3 fatty acids are essential fatty acids, and we're talking about heart disease now, essential for good heart health. And doctors, most ordinary doctors are not trained in nutrition, and that's okay. That's not their job. That's my job. I don't know how to do surgery. I don't know how to prescribe drugs, but I'm really good at helping the body get healthy. So if you want to make an appointment, drjoe.com, or send me questions through the website, drjoe.com. We're talking about warning signs you'd never want to ignore. If you're cold, you're pale, your hands turn bluish, could be a circulatory issue. Now, again, nitric oxide might solve that problem. I don't know. But if you have a circulatory issue, there's something called Raynaud's phenomenon or Raynaud's disease, when people's hands get cold to the point where they actually turn white, especially in the winter. That many times is a circulatory issue. So it could be a pinched nerve in the neck because that's the nerve supply to the blood. That's the nerve supply to the blood supply in the hands or the feet. Could be a nitric oxide issue. Could be dehydrated. Sometimes it's something as simple as being dehydrated. I've had so many people balance out their blood pressure just by drinking more water. So we always try to get to the cause of the problem and not just treat the symptoms. So warning signs you should not ignore. If you have sudden numbness on one side of your body, it could be a stroke. If you start losing control of your facial muscles, you have trouble speaking, you can't puff out your cheeks on both sides, your tongue starts to feel numb on one side, that could be a stroke. The quicker we get you medical care, the better off you're going to be. So if you think you're having a stroke, get to the emergency room and let's get it treated. If I'm wrong, I'm wrong. I blew it, cost you a couple of bucks. A lot of bucks, actually. But it's still worth it. Because if we can fix a stroke, it's nice. And when I went to school, I remember thinking, I was told that when brain cells are dead, they're dead forever. If you ever listen to my early lectures from 40 years ago, I say that because that's what we were taught. Turns out your body's making brain cells every day, new brain cells. And we were wrong. Research changed. Because I remember thinking if somebody had a stroke and then suddenly they did some rehab, chiropractic care, good nutrition, they started to get motion back, I thought, how is that happening? I don't understand that. Wait, the brain cells are dead. How is the body starting to heal? Because the brain can heal, and brain has this capability called plasticity. Plasticity is like plastic. It can remold and reshape itself. So the brain can rewire itself around damaged areas. Isn't that cool? But it needs what? Oxygen, stimulation, and nutrition to kick in peak plasticity. And so we got to make sure we're getting the right amount of all those things in there to get the body working properly. So I'm big on brain and nervous system, obviously. Slurred speech, trouble talking, once again, could be a stroke issue. If you have vision loss or double vision, it could be a stroke or eye disease. I had this happen years and years ago. I was driving and I saw a flashing light out of the corner of my eye. And I thought, well, I don't know what that was, a cop or something like that. Well, then it happened again, and then it happened again, and it was a Saturday. And I called my eye doctor in emergency. I said, listen, I don't care what it takes. I need to see you right away. She came in, she looked at it, and she goes, yeah, it's part of aging process. The retina is starting to detach a little bit. It'll go away. The other eye will probably happen in the next couple of months. And sure enough, it did. So it's just part of the aging process. But I wanted to make sure I wasn't having a stroke. And I paid extra because it was a Sunday visit. You know what? Staying alive was worth that extra, or whatever it was, a couple of bucks. I got to go to break. If you have any health questions, send them to me through my website, drjoe.com. We got part 2 coming up. Don't worry. drjoe.com. Make an appointment. The supplements we talk about, all of them are on our website, drjoe.com, in a store section. Look through the supplements. Look through all of them. Find out which ones you think would fit your needs. If you have any questions, email me. Happy to help you out. Follow me on social media. We used to post every day. We now post twice a day. Giving you health tips, absolutely free. Facebook, Instagram, YouTube, TikTok, LinkedIn, Dr. Joe Esposito. Facebook is the Dr. Joe Esposito. the podcast that we do, Dr. Joe for the Health of It. It's on our website at the bottom of the homepage, or just subscribe to the Dr. Joe for the Health of It on your podcast service, and, of course, the YouTube as well. Folks, I'm Dr. Joe Esposito. Don't go anywhere. We'll be right back. Oh, man. I'm talking a lot more than I used to. I'm going to have to do part 2 on this one, too. So, yes, question, John?
How does one measure the inflammation level specifically in blood vessels and arteries?
You can't remember specifically. You can do something called C-reactive protein. And C-reactive protein tells you how much inflammation there is overall. And so that's what I like to do. I'll measure a C-reactive protein. Now, you can do a full body scan. Pronuvo is one of the companies, I think, that does it. Virtual Imaging does it. And they can do a full body scan to see if there's any plaque building up in the arteries. I think that's a good idea. I've had both companies scan me, and I think they both do a great job. Just to make sure. My plaque level, by the way, is 0. But it scans. It can even find little tumors and early cancers and stuff like that. So I like that. I hope that's going to be the trend in the future. But specifically for the blood vessels, I would just say the C-reactive protein, but that's overall. So. Or just assume you have it and act accordingly. Start eating better. What else?
What do you have a TBI from?
I was hit by a car when I was 10 years old. I was hit by a car. I was in a coma for several days. And, yeah, TBIs never go away. You only have some part of the TBI left. And I was 10 years old. That was many, many years ago. And, in fact, I took the certification class in traumatic brain injuries, and I just spoke at a big international conference on traumatic brain injuries, the Southeast Neurotrauma Conference. And I was the guest speaker, one of the guest speakers. And I talked specifically about what to do for a TBI case. We can diagnose the heck out of it. What's the treatment protocol? That was my job. So that's what we talked about. We talked about nutrition, which is kind of cool, and other things too. All right. So more questions?
Is dressing and stuffing okay?
No. I love it. I don't know what do you want to call it, dressing or stuffing. That's the gravy and sauce argument there. One of my favorite foods in the world. Absolutely. My mother used to make it. She'd take stale bread and then soak it in water and wring it out and put eggs in there. And she put liver, chopped up the gizzards and chicken liver and onions, and absolutely one of my favorite foods in the world. Now, it's not a good idea because chances are it's made with what? Bread, of course, and the bread is going to not be good. If you're going to do a stuffing, I'd recommend a gluten-free stuffing, organic, and, of course, no chicken liver or anything like that. It's still just way too many carbohydrates, but that's what I would suggest. So. But I like it. Not going to lie. Celery and onions sauteed up. I used to like chicken liver, too. I don't eat it. It's not good for me. And that's the whole thing. You can like something and not have it in your life. It's okay. I used to joke, I liked Olivia Newton-John. You know, I couldn't have her in my life. I just liked her, you know. So what else you got?
Is sweet potato souffle okay?
It depends how you make it. You're going to put marshmallows in there and sugar and everything? No, if you're going to do a sweet potato, I would look up a vegan sweet potato souffle and use all natural ingredients. Then it's spectacular. It's wonderful. Sweet potatoes are awesome. So a lot of Thanksgiving questions coming in today here. What else you got?
I have very high LDL levels. What are the best foods for this? Avocados, blueberries?
I just met with somebody a few hours ago who had very high LDL levels. It's funny you'd say that. The LDL is what we call the bad cholesterol, right? So HDLs bring cholesterol back to your liver. LDLs bring it out from the liver. So what happens is sometimes the liver can get clogged up. So think about this. We send cholesterol out into the blood, and it gets used for a lot of different things. Cell wall production, hormone production, brain function. That's why too low cholesterol is very dangerous. And now what's left goes back into the liver and gets recycled. So you have these ports that the cholesterol can dock in basically and get recycled. If those ports are clogged up, you may be putting cholesterol and it's not getting back in. That could be the problem. It's not getting recycled. So you're just putting it out, but not recycling it. So what can we do about that? You've got to clean out the liver. So what I want you to do is send me an email through the website, drjoe.com, and I'll send you a lecture that I did on cholesterol, and I'll send you a lecture I did on liver function. And that's going to really answer a lot of your questions. It's too long to answer right now, but I'm happy to send that to you. And by the way, it's no charge. I do all this for no charge. What else?
That is all.
Great. All right, let's do part 2. Where was I? Here we are. All right, ready? Hey, folks, Dr. Joe Esposito. If you just joined me, welcome. If you stayed with me, thank you. I certainly appreciate that. We're talking today about warning signs you should never ignore because I see this all the time in my practice. I can probably do 100 shows on this. I don't know about 100, maybe 50 of shows on this because so many people come in, and I started this show earlier by saying they're taint nothing patients. Oh, that taint nothing. Don't worry about it. Ain't nothing, taint nothing. See, I'm playing a little play on words there. It ain't nothing. Don't worry about it. No, it could be something. And that's why a good doctor is going to say, all right, let's find out where this is coming from. So we talked about circulation earlier and heart issues, but now we're kind of on brain. If you ever have the worst headache ever and you're writhing in pain, get to the emergency room. It's not something you want to ignore. It could be bleeding inside your brain. If you just faint or suddenly collapse, it could be low blood pressure. It could be brain issues. So, of course, if you collapse, I don't want you to just, say, I feel better, I'm coming around. Go get it checked. I know it's ridiculously expensive to go to the hospital. I know insurance companies just stink. Oh, we got a $5,000 deductible, and you didn't turn left instead of right, and so we're not going to cover it. I mean, don't get me started on insurance companies. This is why you have to take care of your own health. It's so much cheaper if you take care of yourself than if you wait till something breaks. Just like your car. Anybody ever buy a new car? Recently, what happens is you buy a new car. As soon as that check engine light comes on, I remember I was driving one day. I saw the check engine light come on as my phone was ringing. And they said, this is your dealer. It's time to get set up for your next service. And I thought, my God. I mean, it was spontaneous how quick they were. So we're going to take care of our cars. Why? Because if I don't maintain my car, I could lose my warranty. And I don't want to lose my warranty. And yet you don't think about that with your own body. I've got neck pain, back pain, shoulder pain, numbness, tingling, acid reflux, heartburn, brain issues, brain fog. I'm not thinking like I used to. My risk of heart disease, diabetes, and cancer is skyrocketing. I'm going to wait till it breaks. And yet as soon as that light comes on in your car, if it's under warranty, you're going to get it to the dealer because you don't want to ruin your warranty. How insane is that? I can buy a new car. I can't buy a new me. So take care of yourself. If you have these symptoms, be worried. If you start getting dizzy or losing your balance, this could be a lot of different things. It could be the back part of your brain called the cerebellum. It could be the inside of your brain, called the cochlear, the canals in your ear. That can cause you to get dizzy. It could be a digestive issue. Remember earlier we talked about the vagus nerve and the enteric nervous system that controls your digestive system, and it's hooked to the other nervous systems through the vagus nerve. That's why if you get seasick, you throw up. If you get dizzy, you throw up. They're all connected. So sometimes dizziness could be a digestive problem. So let's fix the digestive system. If you start having sudden memory loss, now, as we get older, I think about this. Is this normal? Oh, I forgot something, or is this an issue? So I always think about my brain every day, and I think, what does my brain need? Oxygen, stimulation, and nutrition. So what do? We stand up straight. We breathe properly. We do breathing exercises, maybe meditation. Go out for a walk. Get out in the forest. It's called forest bathing. Inhaling what we call negative ions that help the body heal. It's pretty amazing stuff. So I forget things. We all forget things periodically. But when it becomes an issue, that's when we have to be concerned. And then also if you start having memory lapses, think about it. What did I just eat? Well, gosh, I went drinking last night. Well, your body can't handle alcohol like it used to. I had a steak dinner last night. Was it organic? How much was it? You can't, not cost-wise, but how much steak did I eat? My body can't handle it like I used to. So start to correlate symptoms with lifestyle. Oh, I like that. I'm going to write that one down. Correlate symptoms with lifestyle. And you'll be amazed when you start to see the correlation. I didn't sleep well last night, so I'm a little dopey today. Well, that could be it. But you can't remember where you live. That could become an issue. Got to go get that checked. If you start having seizures, get that checked. I had a patient one time, first time, early in practice, maybe 35 years ago or so. And she said, I have seizures. And when I do, this is what you have to do for me. Lay me down, lift my head up, bring my feet up, and I'll come out of the seizure in a few minutes. And I thought, well, it's not going to happen in my office. And I was treating her one day. I was adjusting her, and she just started convulsing. I thought it was a joke. I mean, it was almost like something from the movies, right? She was possessed by an alien or something. So I remember what she said. I laid her down, lifted her, tipped her head back, and turned her head to the side so she didn't throw up, lifted her feet, and about a few minutes she came out of it. And she looked at me, she goes, did I just have a seizure? I You don't remember that? She goes, no, I don't remember my seizures. I thought, wow. But she knew what to do about it. But if you have a seizure, get that checked. And if we start seeing tremors start to happen, like a Parkinsonian tremors, they're called, it could be that your body is low in dopamine. Now, there's some studies out that there's something called velvet beans or fava beans, and they seem to work as well as some medications for tremors. And I've had people say, I don't even know what velvet beans are. I've never seen them before, but I looked them up online. They're a type of bean, or fava beans. Velvet is the highest amount, and they have dopamine in them, or dopamine precursors. And I've had patients with tremors take them, and I watched the tremors start to get better. Now, dopamine is a neurotransmitter. It's in your brain. Dopamine comes from tyrosine. Tyrosine is an amino acid. When you eat food, pretty much everything except water has protein in it to build a structure. There's 20 amino acids in the human diet that we just configure in different shapes and forms to produce different things. Eye tissue, blood tissue, hair, toenails, bicep. It's those 20 amino acids just being reconfigured in different patterns to produce different proteins. So tyrosine in the digestive system becomes dopamine in the brain. Dopamine becomes norepinephrine, which gives you energy. So a lot of times when I see people with neurological issues, with muscular issues, with balance issues, we got to look at their digestive system. Are they breaking their food down properly? If they're breaking the proteins into amino acids, then we need B vitamins, a methylated B complex, as catalysts, or things that make it work better. And so we get them on a good diet. We get them on easy-to-digest proteins, usually plants. We get them on digestive enzymes. I take a digestive enzyme whenever I eat a cooked meal. If I don't, I blow up. I get bloated. So I take a digestive enzyme. Now, if I eat a raw meal like a salad or an avocado or something, no big deal. But if I'm going to have beans, if I'm going to have onions, garlic, things that are high in fructooligosaccharides, these are types of sugars that have trouble, some people have trouble breaking them down. I do. And so if you can't break them down, they essentially putrefy and become, actually they ferment and they become gases. And so if we can break down those sugars, we solve that problem. And I absorb my nutrients better. So whenever I eat a cooked meal, digestive enzyme. You should do that too, especially if you're over 30. If you're under 30, you might be able to get away with it. But this is a neat little trick, and enzymes are really cheap. Dr. Joe's Digestive Enzymes on the website, drjoe.com. I carry it with me. Have it in my car, have it in my office, have it at home. Eat a cooked meal, pop a digestive enzyme. Pretty simple stuff. This is not hard to make these changes. But when you're breaking the proteins into amino acids tryptophan, tyrosine becomes dopamine. So we get you on something like fava beans and velvet beans. We get you on digestive enzymes. If the stomach is pushed up against the diaphragm, we physically pull the stomach down away from the diaphragm so you can digest your food more efficiently. Easy to digest proteins like plant-based proteins. And then we're giving the brain all the nutrients that it needs, plus a B complex, for the brain to start to produce its own dopamine, which then suppresses some of the tremors. And GABA is another neurotransmitter that can suppress other things in the brain as well. About 80 to 90% of your brain is suppressing the other 10 to 20%. And when that balance is off, that's when we start having big issues. So much of what we're dealing with is neurology. And neurology is chemistry. And chemistry in the human body is food, in most cases. So if we can get the food right, we can get the chemistry right to feed the neurology so the brain can work again. It really is cool. And I think sometimes people say, if you didn't become who you are, chiropractor, nutritionist, pain management expert, if you didn't do that, what would you have done in life? I love being a doctor. I think it's fun. So I think about my friends who are orthopedists, neurologists, neurosurgeons, and most of them aren't thrilled with their job. I've spoken to 3 doctors now in the past maybe 6 months that want out. I'm quitting. I don't want to do this anymore. One of my friends, I met him at a party, tall, good-looking guy, didn't know what he did, so we're cutting up, having fun. We're kind of like almost instant friends. And I said, what do you do for a living? He says, I save babies' lives. I said, well, that's a pretty cool job. I don't. Well, I do sometimes. And he said, no, I'm the head of a pediatric emergency room at a local hospital, very well-known hospital. And he said, I've been doing it for 30 years. He said, I'm bored out of my mind. He goes, I want to do what you do. I said, what do you mean? He goes, we have to follow protocols. Kid comes in with this, we have to do that. Sometimes you got to think outside the box. He says, I listen to your show all the time. He said, I'm just amazed how you break things down so simply and make it sound so easy. And it's not easy unless you're good at it. And he said, I'm just fascinated with what you do. He said, I would love to do what you do. But he went ahead and got his MBA, his Master's in Business Administration, and he wants to go into real estate. Wow, all those years of study, he wants to go into real estate. So take care of yourself, because the doctor you're seeing may be ready to retire, may not want to do what he wants to do anymore. And that goes for everything, chiropractic, orthopedist, neurologist, dentist. So this is where you have to take control of your own health. And that never ends. You brush your teeth twice a day, I hope, right? That never ends, does it? You can't say, I'm not going to do it anymore. I'll wait till I get cavities. No, you brush your teeth all the time. That's how I want you to think about your health in general. Is my nervous system getting checked on a regular basis? Is my digestive system getting checked on a regular basis? Is my diet getting looked at by somebody who knows what they're talking about? Am I taking the right supplements? Should I continue taking these supplements? I don't think supplements are a luxury. They're a necessity for good health. I cannot imagine why people wouldn't take quality supplements. Had a fellow come in the other day, almost exactly my age, a few days away from my birthday. And he says, these are the supplements I'm taking. And I said, where'd you get them from? He goes, big box store. I won't say the name. I said, okay, this one is not methylated. I wouldn't take this one. This one is vitamin D3. It didn't have K2 with it, which means you can build up calcium in your arteries and it can lead to heart disease. General men's supplement, men over 50 supplement. And I said, well, not a good idea because a lot of it is synthetic. And he said, that's why I'm here, Doc. He says, I hear you talk all the time and you make sense. And I'm just going in the store going, I guess it's okay. Vitamin B is vitamin B. Not necessarily. Is it methylated? Is it cyanocobalamin or methylcobalamin? Cyanocobalamin B12 has cyanide on it, attached to it. I don't want to do cyanide. I want you to do methylcobalamin. So you turn to the expert. I have an accountant who does my taxes. I have a car mechanic who does my car. I have a guy named Joey who fixes all my air conditioning heating units. But I want to be your expert. I want to be the one you come to with your health problems. And let's see if I can do it on our own, if we need to co-manage it. So if you want to make an appointment to come see us in the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. Just go to my website, drjoe.com, and you can book an appointment. Normally the first visit is $980. I've reduced that to $299. That's an exam, x-rays, consultation, first treatment, going over the x-rays on your follow-up visit, a complete nutrition evaluation. Let's find out why your body is malfunctioning. I tell every patient when you come in, I'm going to do something nobody's ever done before. I'm going to try to find out why. Let's get to the cause of the problem and not just treat the symptoms. I'm okay treating the symptoms, but let's also treat the cause. Unique way of looking at healthcare, but works really, really, really well. So, drjoe.com. If you have health questions, send them to me through the website, drjoe.com. I'll answer them if I have an answer for you. Somebody sent me an email the other day about something. I didn't know what it was. I looked it up, still didn't know what it was. I said, I don't know. You got me on this one. Never heard of this before. But if I have an answer, I'll give you the best answer I possibly can. drjoe.com. All right, so we're talking today about warning signs that I don't want you to ignore. Health signs I don't want you to ignore. So I want to talk about the lungs now. I kind of talked earlier, the first part, about my father, because my father had his lungs were clogged with mucus. And I came home one day, if you didn't listen to the first part of the show, and I was in the first year of undergraduate school, and he couldn't breathe. He's gasping for air. We rushed him to the emergency room, and his lungs were full of fluid. Now, the doctor told him not to smoke, and he smoked. Well, okay, don't do that. So if you can't breathe, of course, get to the emergency room right away. If you have a cough that lasts more than 3 weeks, that's something you don't want to ignore. So if you have a persistent cough for a long time, let's go get it checked. Now, it could be something simple. I've had countless patients over the years come to me, persistent cough, sinus infections, their throat, they're losing their voice. And I check and their stomach is pushed up against their diaphragm, so they're having acid reflux. So the acid is refluxing up into their throat, and that's causing the chronic cough. We pull the stomach down away from the diaphragm. We get them on something simple like apple cider vinegar to stimulate the acid production in the stomach, because acid causes the valve between your esophagus and your stomach to close. So if you're on an antacid, I talk about this a lot, if you're on an antacid to lower your stomach acid, you don't have the acid to cause the valve to close, which leaves the valve open, which causes more acid reflux, which means you take more medication. I'm not against medication, but is there something we can do aside from the medication? And with acid reflux, the answer is very, very, very often yes. So let's pull that stomach away from the diaphragm. Let's stop the acid from coming into the throat, and the cough may go away. I worked for a while with a rock singer named Eddie Money. I don't even remember Eddie Money, 2 Tickets to Paradise. So Eddie worked at the radio station with me. Nice guy. Big fan. Hey, Doc, I listened to your show, man. You're like the smartest guy I've ever heard. But he died of esophageal cancer. Now, I worked with him, and he never told me that he had acid reflux. I don't know if he had acid reflux. I assume he did. That usually is what leads to esophageal cancer, because the acid is coming up into the esophagus, and it irritates the esophagus, and cancerous cells form, and he died from it. And it was sad, because I knew a celebrity. I knew a hotshot who was a fan of mine, And I often thought, had he told me, what if I pulled his stomach down, would have I saved his life? I have no idea if that's true or not. But it certainly makes sense to me, which is kind of cool. So if the stomach is up against the diaphragm, let's pull the stomach down away from the diaphragm. Let's get you on some things like apple cider vinegar to increase your stomach acid, not decrease it, to cause that valve to start to close. And that may help that chronic cough. Now, if you ever cough up blood, now, I understand you cough, you sneeze real hard, you might have a little blood in there, but if you're coughing up blood, especially if it looks like coffee grounds, get to the emergency room immediately. This is not a game. You want to get that checked immediately because that's a very, very serious issue, and you want to get that fixed as soon as you possibly can. If you have trouble breathing when you're laying flat, that could be a sign of heart disease or heart failure. Now, once again, if you're just tuning in, heart failure means your heart's not working as well as it can be, as well as it should be. Doesn't mean you're going to die tomorrow. It's not necessarily an urgent thing, but heart failure means the heart is not working as well as it should. What do we got to do to get it working again? Now, the liver, go off on a tangent here. The liver has this amazing healing capabilities. The liver can regenerate itself. I can remove like 60, 70% of your liver, it'll grow back. Isn't that crazy? Stop beating up your liver. We do it with food. We do it with cigarettes. We do it with alcohol. We do it with toxins in the air. But when the heart muscles are damaged, they don't regenerate. But we can do everything we can to get the heart working the best it possibly can. Same thing with the kidneys. I've told this story before. A couple of years ago, I had a patient named Connie come into my office, and she doesn't mind telling me this when I tell this story. And she said, I'm in 28% kidney function. I'm going to die. I'll do whatever you tell me to do. And she meant it. So I put her on a protocol. I got her off animal proteins. I got her on plant proteins. I got her on certain supplements specifically for kidneys, one called Rena-Food, and we got Super Green, Essential Source, nitric oxide. And about 6 or 8 months later, I get a phone call, and my staff says, Connie's on the phone. And I thought she was going to die. I didn't know why she was calling me. And she said, 52%, hung up the phone. So her kidneys got better, went from 28 to 52%. She's kind of stuck at 52. She's not getting 100% better. But she's alive because of it and still functioning and working and everything else. So there are a lot of things we can do for organs, the lungs, the liver, the spleen, the kidneys, to try to get it working better. Or at least whatever you have left, let's get it working the best it possibly can. Because so many diseases are, they're just degenerative. They just get worse and worse over time. Stop that. At least stop it where it is. And the 3 things we need: normally functioning nervous system, normally functioning digestive system, good nutrition. That's the general plan. Somebody called my show the other day, and they had a condition, a pituitary tumor, benign pituitary tumor. And they said, what can I take to get rid of the tumor? I love when people say that. What can I take to get rid of the tumor? Well, let's stop causing it, first of all. Maybe it's genetic. I don't know what caused it. I said, I don't have a protocol for pituitary tumors. I do have a protocol for general health. He said, I'll do whatever you tell me to do. I said, okay. So I put together the protocol for him. So this is called functional medicine. Now, it's not medicine for me. I don't do medicine. But this realm, this new branch of healthcare is called functional medicine. And we don't necessarily diagnose. We can, of course. We're very good at that. But we always try to find out why the body is malfunctioning. And more people are turning to functional medicine. There are certain doctors now that only see millionaires and billionaires. They only have like 20 patients or something like that, 8 to 20 patients. And what do? They do functional medicine protocols. And I'm thinking, I've been doing that for 40 years. Now we have a name for it? So if you want to make an appointment to come see us, you should, by the way, drjoe.com. Let's do a workup on you. Let's check the nervous system. Let's check the digestive system. Let's check the diet. We can do blood work if we need to. But what I find with this is that if I do the blood work, it's a picture of you right now. Let's do everything we can to get you better. And if we still have residuals, then we can do a blood work to find out what's left. Because everything with the blood work is great, but let's be proactive first. And we can send you out to other doctors if we need to as well. Most cases we don't. Sometimes we do. We talked about the hoarseness, persistent hoarseness. You want to get that checked because it could be acid reflux, but it could be something more serious, like with Eddie Money's case, it was throat cancer. So we don't want to play that game. We want to get that fixed as soon as we can. And let's talk about allergic reactions. I'll tell you about my friend. He eats a pretty good diet, works out on a regular basis, mountain bikes on a regular basis. And he calls me one day and he says, my feet was swollen the other day and it itched like crazy and it went away in a couple of hours. Then his hand swelled up and it got bad. We're out to dinner one night on a Monday night and he says, I think my tongue is starting to swell up. I said, that's an emergency room trip. He goes, yeah, I know. Went to the emergency room. Next morning, Tuesday morning, he texts me about 7 o'clock in the morning. I was in the emergency room all night. They IV'd me with whatever, some type of antihistamine. And he says, and I feel a lot better now, but I'm exhausted. I'm going to go home and sleep. I said, okay. So I call him later in the day. He doesn't call me back. Call him later twice. Doesn't call me back. I text him. Next day, I drive to his house at night. I said, maybe this guy's dead. He just turned off his phone. And I said, listen, single guys, he and I are both single guys, live alone. So we said, okay, somebody's got to check up on us. That's what friends that help out are for. So he said, I'm going to go to the allergist. So he goes to the allergist. They do a test. He calls me up. He goes, you're not going to believe this. I said, what? He goes, I have alpha-gal. Now, if you know what alpha-gal is, you can get bit by something called a Lone Star tick. And it causes you to be allergic to beef products. He says, I bet you that's what it was because the day his tongue was swelling up, 2 days earlier, he had a big rib dinner. He went out with the boys, had his ribs, and so he can't eat any beef products anymore, and that includes dairy as well, because he has this condition called alpha-gal. And there's a sugar, I think it is, in the animal protein that can cause this reaction. And as far as I know, it's pretty new. I've never heard of it. But he mountain bikes a lot, goes back to that statement, got bit by a tick. Doesn't remember getting bit by the tick, but that's how you get this condition. And by the way, it's pretty much a lifetime thing. Now, I don't have a problem with this because I don't eat meat anyway. So maybe I have alpha-gal. I don't even know. But allergic reactions are foreign proteins getting into the body and the immune system just going crazy on it. So that's why I say let's stay away from the foods. The two big foods that are hyperallergenic are wheat and dairy products. So cut out your wheat and your dairy and see if the sinuses clear up. See if the digestive system clears up. I'd say stay away from them anyway, but give it a shot. I'm almost out of time. I'm going to have to do a part 2 on this because I got so much more to cover. If you have any health questions, send it to me through my website, drjoe.com, drjoe.com. You can send your questions. I'll answer them personally. Follow me on social media, Facebook, Instagram, YouTube, TikTok, LinkedIn. We post twice a day. I want to get this information to you. And this is an ongoing learning process. You're not going to get health care in 1 or 2 days. The podcast, Dr. Joe for the Health of It. Subscribe to the podcast, YouTube channel. You get to see my pretty face on YouTube. Let's do everything we can, nervous system, digestive system, and diet, to try to get you well and keep you well. I'm Dr. Joe Esposito, drjoe.com. Hope to see you soon. All right. Questions?
Is popcorn without butter okay?
Organic popcorn, yes. No problem with that at all. Make sure it's organic, though, because otherwise it could be genetically modified corn, and I don't want you doing that. So. What else?
What are the best biscuits to make and eat?
I would say a gluten-free biscuit if you're going to do it without lard. I don't think you should do biscuits. It's pretty much pure sugar, no matter what flour you use. There's gluten-free flours. I don't know if you could do it with almond flour or not, but that might not give you the texture that you want. But I would say a gluten-free vegan biscuit. Not that it's good, but you asked what's the best, so that's the best. What else?
Are whole wheat pasta noodles okay?
No. Still wheat, okay, and whole wheat. Still going to have it's still going to have the phytic acid in it. Phytic acid can prevent you from absorbing certain things like calcium and iron. It's still going to have the gluten in it. So if you're going to do a pasta, I'd recommend like a lentil pasta, like a gluten-free pasta certainly would be the lowest end of it, but then like a lentil pasta would be a better choice. So, what else?
Is high blood pressure and atherosclerosis related?
Yes, absolutely, because the blood pressure puts pressure on the blood vessels. Blood vessels are elastic. They're supposed to expand and contract. And if they don't expand properly, then you can build up blood pressure. So you're putting pressure on these arteries that don't want to expand, and you can damage the arteries. So the body says, in its infinite wisdom, I got to make these artery walls thicker. The pressure's getting bigger, higher and higher. I got to make the walls thicker. So the body lays down cholesterol, plaquing, to make, like cement, to make them harder and stronger. So the answer is yes. And also high blood pressure can be linked to erectile dysfunction, urinary issues, kidney issues, brain function, Alzheimer's. And 50% of us in this country have high blood pressure. And nobody's talking about something as simple as Dr. Joe's nitric oxide support, fixing the stomach. So we have answers. May not be all the answers, but we have other options, let's say. What else you got?
Is soy milk with cinnamon a healthy dessert choice?
Yeah, not bad. Do organic soy, but I'm okay with that. Sure. Absolutely. Make sure it's organic, though, because it might be genetically modified soy otherwise. There is a movement in government to get rid of genetically modified food. I hope it passes. What else?
Any advice for the safety of young football players?
If I can go talk to myself as an 8th grader, I would sit myself down and say, don't do it. I have so many permanent injuries from playing football and hockey. Never even got to date a cheerleader. Dated a girl in a band, but that didn't count. But I never even got to date a cheerleader. So unless you're going to go pro, and even then, all these professional athletes, I remember Ed Marinaro. I was sitting at a dinner one time. I'm talking to this guy next to me, an older fella, and I looked down. He's got this big ring on his finger. I look at him. I said, "Are you Ed Marinaro?" He goes, "Yeah." I said, "Oh, my God." So we chatted for a long time. And he said, "Let me tell you, Joe, my knees, my shoulders." He says, and he was an actor. He was in Hill Street Blues, good-looking fella. And doesn't matter good-looking or not, you're going to get hurt. So if I could give advice to a young football player, it would be don't do it. Join a band. You can play guitar forever. So what else?
That is all.
All right, thanks, guys. I appreciate it. Please follow me on all platforms. Any questions, drjoe.com. Hope to see you all.